So health departments in all provinces except KZN underspent their budget by 3 billion rand. That's for the 2022-2023 financial year. This was revealed by Health Minister Dr. Joe Phaahla in Parliament recently. Gauteng underspent its total allocated budget of 2.7 billion rand. The Health and Allied Workers in the Indaba trade union has raised concerns over the underspending and are calling for the dismissal of all the health MECs. So what impact does underspending have on the state of healthcare? Well, to have that discussion, let's bring in budget researcher at Section 27, Matshidiso Lencoasa, into the discussion. Matshidiso, good morning to you. Thank you so much for joining us. I think this is an important one because when we start throwing around the numbers and you hear a 2.7 billion rand, it's shocking. And then at the same time you hear about the massive staff shortages, equipment shortages, and so many other challenges that our health facilities, our public health facilities are having. So make sense of it. I mean, explain to us why we're still having this discussion in 2024 before we start getting into the nitty-gritties of it.
Yeah. So you are absolutely right about how shocking it is that there's still underspending, considering that the health departments and the public health system is one that is actually under-resourced. We know that when we think about public health facilities, they're not where they need to be. And so we've been calling out, I think civil society and many people have been calling out for increased budget, increased investment so that we can improve the quality of life for people in this country and realize the constitutional right to access quality healthcare services. So when you hear reports or figures like that there's been so much underspending, it is really concerning because even the funding that is available, that limited funding, isn't actually being spent on realizing those constitutional rights to health, the constitutional right to healthcare, and that creates an additional barrier to realizing that. And so we really do see the underspending that is prevalent in the healthcare system. Yes, in South Africa, globally, it does happen globally, but it's more pronounced in a country like ours when we still have so many challenges when it comes to realizing healthcare access for all in this country. That underspending does undermine that right to quality healthcare services.
Where are we seeing the biggest challenges where the departments simply aren't using the budgets that are allocated to them, particularly in areas where they're most needed? Where's that gap the widest?
Sure. So it is quite pronounced in infrastructure spending. So we have infrastructure backlogs in South Africa, and we know that with our public healthcare system, there are still facilities that need to be repaired. There's still issues that, like the infrastructure is quite dilapidated, and that reduces the quality of healthcare spending, healthcare services. And so we see it a lot in infrastructure spending. There are issues with procurement, issues with paying suppliers, delays in actually building these facilities, upgrading these facilities. But we also do see it with HIV/AIDS spending. So we know that positive news in a sense that South Africa is able to get antiretroviral treatment for cheaper, meaning that we can have greater access, so it's not as expensive for the state to get antiretroviral treatment. However, instead of taking that underspending or using it to scale up antiretroviral coverage in the country or to ensure that more people uptake that, there's a greater uptake, that actually ends up being returned to Treasury. And so really what we see is that everybody in the country pays taxes, be it through VAT, be it through salaries, be it through fuel levy when you pay for your taxi fare, whatever it is, but then those funds don't actually translate into quality or universal health coverage for all in the country.
Why? Why does that happen? How is it that, when we get... Because this is the thing. Up until the budget speech that we had this year, right? This year's budget speech last month. Weeks prior to that, we were having discussions here on Newzroom Afrika with, health practitioners who were essentially saying we need jobs, we need, budget allocation for us to have jobs, and so many other issues within the health sector that need, again, the money. But then we're hearing that the Western Cape didn't spend 100 million rand. The Northern Cape didn't spend 141 million rand. Limpopo 103 million rand. And I can go on and on and on because some of these numbers are shocking. Listen to this. Northwest Province didn't spend 200.6 million rand in their health department. Why? What is actually going on in that process of the money hits the department's account, if you will, where it needs to be disseminated, it just doesn't? Why does that happen?
Yeah, so I think the biggest challenge, or this points out to the lack of capacity in the provinces to actually spend the money. So often they get into contracts with maybe implementing agents or private sector, and for whatever reason, the delays or maybe not understanding the procurement process, it ends up translating into further delays and also just end up like not spending it. So I think one of the biggest issues that we do have in terms of underspending is that we may have I guess we could say we may have capacity shortages, and we really do need to invest in quality capacity building, but also consequence management. So what happens when there's underspending? Who gets punished? Really, right now what we see is that National Treasury ends up, much of the funding, if it's not being rolled over, it gets returned back to Treasury. And that is a concern because it means that the everyday healthcare user, public healthcare user, gets punished because they didn't get that service, and there's no repercussions for the people who didn't underspend because they were not the ones who underspent the budget, and yet they don't get quality services. So really we do need to invest in better capacity building in the provinces, and to ensure that they can actually spend the money that they are requesting for to fulfill these quality healthcare services.
Yeah, I mean, what's the role of civil society organizations like Section 27 then to call for more accountability? I mean, talk to us about work that you're doing, or how you're speaking to the various departments or Treasury, if necessary, to say, well, this simply isn't going to work for us.
Yes, so we have long advocated, especially last year, we were advocating about in infrastructure underspending because of the impact, as we mentioned throughout this interview, but really is to call on Parliament, is to call on National Treasury to, rather than punishing the everyday user, healthcare user, with taking away the budget, that funding needs to be redirected to actually improving the quality of people who actually work in the provinces, hiring people who can actually spend the money, for instance, ensuring that there are consequences and there are incentives to actually spend that money, and it's not just we have a chronic underspending issue in South Africa and that's it. So really just advocating and realizing that it doesn't have to be this way. There are solutions. Yes, underspending plagues many economies across the world, but it's more pronounced in a country like ours, and we can actually fix it. It doesn't have to be this way.
Yeah. Here's the reality for a person who is living perhaps in a village in Northwest somewhere. They're going to go to their local clinic or a local health facility and need medication, and when they're told that the stock is out, and they hear this, that however 100 million, what is it, 200 million rand was sent back to Treasury because it was underspent. That's heartbreaking, because for some people it's the difference between life and death. But we're going to have to leave it there. Matshidiso, thank you so much for speaking to us. Matshidiso Lencoasa, budget researcher at Section 27, speaking to us about provincial health departments underspending their budget.